Good morning. My name is Michael Chang. I'm the Chief Medical Officer for the USA Healthcare System, and I think we're gathered here today to just have a little conversation about what's going on with Thanksgiving and COVID, both in our region and across the country. And as you guys know, we're getting both good news and bad news. Good news on the side that the vaccines are moving towards being available for administration sometime in the next few to several weeks. And on the other side of things, I'd really like to emphasize that we need to be real extra careful with the Thanksgiving and holiday season that's coming up. You know, we've seen a spike both regionally and within the state in terms of, and actually nationally, in terms of the incidence of COVID after Halloween. I don't know that it was immediately attributable to Halloween, but we've seen it go up starting about a week after Halloween. And so now we've got Thanksgiving and Christmas coming, and we want to make sure that the public knows that we would encourage everybody to take extra precautions. Limit your travel. If you do travel very safely. Always wear a mask when you're within 6 feet of people, and wash your hands frequently, and maintain your social distancing, because unfortunately where we think we're heading is a much higher risk situation after Thanksgiving and with the other holiday seasons coming. So that's the message that we'd like to get across.
And the concern is there's not enough space in the hospitals to handle the influx.
Well,
what's
exactly
the nightmare scenario that you worry about?
Well, that's right. And when people ask about the incidence of COVID and what it means from a healthcare system's perspective, we want to make sure that we have capacity to care for the people that need the care within all the hospitals in the region and around the country. And that's exactly the most important thing to be keeping in mind. Yes, ma'am.
What's the capacity here right now? What level are you guys at with beds? How many beds?
Well, our hospital's been full. Okay, let me back up on that. Our hospital's been full ever since the COVID, functionally full ever since COVID started. We're full right now, and we do have a number of COVID patients both in the hospital here at the University Hospital and at Children's and Women's Hospital.
Are you running out of beds, or at what point how many beds are left?
So today University Hospital is full, and it has been for the overwhelming majority, probably 2/3 of the time over the last month.
What about ICU beds? Is there any capacity there?
So every day our ICU, we've started off our days with 0 ICU beds available, but we've been able to make room as the day goes on, and they fill up again cyclically throughout the day.
So you're pretty confident about the process and how you're able to move patients to the hospitals without having any kind of crisis situation.
So we've not had any crisis situations, and the daily churn of moving patients in and out of the ICUs, like I said, is ongoing.
I got a question about, you mentioned concern about the holidays. You know, the state has changed some of its parameters with its guidelines in the last couple of weeks. The governor loosened some restrictions at restaurants. Are you particularly concerned about indoor dining leading to a spike around here?
I think indoor dining is something that always needs to be taken into consideration. Anytime, like for example, why is wintertime a more dangerous time for respiratory diseases than spring and summer? Some of it may have to do with the viruses that are being transmitted during the wintertime, like the flu or the common cold or COVID, but as well, it's because people tend to congregate indoors more. So the more you're indoors and the more you're in tight spaces, the higher the risk of transmission. There's no way around that. That's a biological fact. So anything we can do to minimize crowding indoors is important.
Are you worried that 2 weeks after Thanksgiving you will be at a crisis point here because people will have been gathering and not adhere to the warnings that you're issuing today?
Well, you know, we're always worried about hospital capacity, and the experience over the last 6 months has been that when there are events that encourage gathering of people, whether it's Mardi Gras, whether it's July 4th, whether it's Halloween, that we seem to see a bump in cases afterwards. And so yes, our concern is that with Thanksgiving, with the travel that's associated with Thanksgiving, and the bringing together of circles of people that may not always spend time together on a daily basis, that there may be an increase afterwards. Yes, ma'am.
Because you're already at capacity right now, you can't.
Well, I can speak for our hospital. The University Hospital is full today. Yes, ma'am.
You brought up Mardi Gras. It's interesting because we are talking about kind of a timing here of vaccine coming out in the spring, and there's a lot of people around here that's a big deal to a lot of folks. So what is your thoughts and/or concerns about this annual event?
Well, I think the concerns are just as I've described. The concerns anytime you have gatherings with large numbers of people, especially large numbers of people that don't spend a lot of time with each other in their own little circle, so to speak. Where we end up in Mardi Gras remains to be seen, but that's something that needs to be planned and thought through very carefully, both in terms of the decisions as to what activities to have, if any, and if any activities are had, how you manage them. None of those decisions, to my knowledge, were made yet.
What's your ideal situation for Thanksgiving for people who do choose to gather? Because I know there's going to be people that are going to get together. What do you see Thanksgiving as?
Well, we would encourage, if folks are going to spend time with family members and friends at Thanksgiving, we would always encourage that if it's going to be within new circles of people, so to speak, that you isolate as much as you possibly can for the 5 to 14 days beforehand. Starting today, isolate as much as you can before you start meeting, before you anticipate meeting with other groups over the Thanksgiving holidays.
And then once you are together, how do you anticipate masks on during, family time? How do you see that?
So I think that will be according to the composition of the groups that you have. But we would always say the safest thing to do is if you're going to be spending more than 15 minutes of cumulative time with people within 6 feet of people, that you should be wearing a mask.
I know early on in the pandemic, local doctor, I think you spoke before the city council and
Yes,
urged
ma'am.
leaders to do a mask mandate. That was early on. Do you anticipate publicly speaking and urging local elected leaders or state officials to take any kind of policy, make any policy decisions? Do you foresee that?
So to date, we have not. I don't know of any other public situations coming up where as a group I would be doing something like that. So I can't answer other than to say I really don't know, because nothing's come up on the council.
Knowing this is a fluid situation, but we keep hearing about these new vaccines coming out. 94% Moderna came out today with some news. What is your expectation for getting healthcare workers here in the hospital vaccinated, moving in a positive direction?
So the Alabama Department of Public Health is working very closely with the CDC. It has submitted a vaccination plan to the CDC. And as the vaccines become available, the Alabama Department of Public Health will roll that plan out to all the regions within the state and the facilities within the state. Within that will be, as we understand it, a tiering of vaccine distribution based upon the availability of the vaccine. And we'll follow whatever guidelines the Alabama Department of Public Health makes available to
Do you
us.
have any expectations of that happening next month or eventually?
In the best of all worlds, I think that we're thinking that it would happen towards the end of this month, which we're already at, or sometime in the next month, yes. But we really don't have any details, so I really can't make any firm comments on that. But thank you.
Has the trend of coronavirus cases that they've been increasing steadily over the past couple of weeks, has that been concerning for you as the head of USA Health?
Yes, it's been very concerning for lots of reasons. Number one, at the level of the health of the general population, the pandemic is worsening, not getting better. That's absolutely a concern. It's a concern for all the healthcare facilities, not just in the region or the city, but in the country as well, because really, from our perspective, a critical inflection point occurs when the needs for the population exceed the ability of the healthcare system to meet those needs. Not just for the COVID patients that are COVID-19 positive, but for all those other patients that otherwise would need help as well, for which perhaps procedures are delayed, healthcare visits are delayed, they may not feel comfortable coming to the physician's offices and so on. We want people to get right patient, right place, right time. Patients should get their timely health care when they need it, and it should be available for them. And the pandemic has all sorts of implications along those lines, both for those with COVID-19 infection and for the others as well.
Have you seen more patients needing that emergency care because of delayed visits and delayed seeking help?
So after the initial wave of closures back in March and April, we did see a significant spike in demand for procedures, physicians' visits, and all those things. No different here in our healthcare system than anywhere else in the region of the country. But yes, there were a lot of folks that were making up for lost time, so to speak, by having put things off in March and April and May, whether it was surgery, whether it was physicians' visits, or other kinds of treatments. There was a spike. Things seem to have leveled out for the most part since then.
Could you speak specifically about effects to your healthcare workers here at USA? As far as how many cases have been reported, if it's had an effect on manpower or staffing levels?
So that's a really broad question. The question of manpower, the pandemic certainly has affected the workforce in healthcare in lots of different ways. Number one, with the restrictions that are placed when you're exposed as a healthcare worker, you have to stay away for a certain period of time, variable lengths of time, depending on what level of exposure you have to patients and so on. But that does affect our workforce. Number two, with school starting, the opening or non-opening of various schools at different age levels and within different communities affected the availability for childcare, right? So the healthcare workforce was affected because of childcare issues. Number three, different parts of the country are offering major differentials in pay to bring healthcare workers to where they're needed, and what that's done, for example, in New York, for the wave that was in New York in March and April, lots of other places around the country lost significant number of healthcare workers because the pay was so much higher for traveling workers there than elsewhere. So all those things combined, plus healthcare workers getting infected or having members of their family getting infected, affect our healthcare workforce, and that really does have implications, as well as the infections themselves, on the hospitals and the healthcare system's availability to be able to provide care. So that's a really good question.
With Thanksgiving break and leading to winter break for a lot of schools, colleges, are you concerned about people that have been, in different states for college coming back home and coming back here and potentially bringing more virus and infections here?
Yes, anytime that you're going to see an increase in travel, whether it's associated with a school year or whether it's associated with a holiday, there are concerns, and that's why we're having this little get together this morning, is to just make sure that everybody knows that the virus doesn't take a break, right? The virus doesn't know about holidays. The virus doesn't know about travel. The virus is the virus, and we always have to be vigilant in how we prevent the spread of the virus, both to other people and how we protect ourselves from viral infection with these changes in travel and in gatherings and so on. All righty.
Thank you.
Thank you all very much.